These are patients who have potential living donors but have been found to be incompatible with those living donors. And their only other option, if we didn't offer our paired exchange and incompatible programs, would be for them to sit on the deceased donor waiting list to wait for a deceased donor kidney to become available. Depending on what their blood group is, some of those waits can be as long as 10 to 12 years in the state of Alabama. And if they're sensitized, they may wait for many, many years and never find a match. Almost half of patients are found to be incompatible with their potential living donor. And so there are ways to get around that incompatibility. One is to do something called desensitization, and that's really a process where we remove the antibodies that are potentially harmful to allow you to cross that barrier so that the patient doesn't reject the kidney. The other option is to try to find them a compatible match, and that's really where the paired exchange program comes in, with the goal being to swap kidneys literally. So take two pairs that are incompatible and match them with compatible donors. And that's really what we're able to offer here at UAB. We're able to combine both a paired exchange program along with our desensitization program. And as a result, we're a bit unique in the Southeast, as we're the only center that offers that at the moment. Anne-Marie is an incredible individual. She's quite young. She's in her 30s. She required her first transplant as a child, and that lasted her many years. She went on to need a second transplant that unfortunately she lost relatively quickly. And what that did was left her highly sensitized based on the prior 2 transplants she had, and also the need over the years for several blood transfusions. Both of those things contributed to her level of sensitization. We entered her and her donor into our database, and what we were able to find was a perfect tissue match for Anne-Marie, but a blood group incompatible transplant. And so Anne-Marie participated in a paired exchange that involved a swap, but also involved her undergoing desensitization such that we could cross the blood group barrier. Ultimately, I think for her has been extremely beneficial. This is a young woman who now has a normal creatinine at 1.2 and has her life back and will be off dialysis and be able to go out there and live the life that she's hoped to do.